How's it? Right. Thanks. Thank you so much. How many of you have felt like as we go further and further along, the village is getting more and more almost like isolated from the core family? When I grew up in the 60s, I'm dating myself, of course. It was really commonplace for grandparents to be right next door. And that if I got in trouble in school, it seemed like before I even saw my mom, she already heard it from three people. And and yet, as when I was trained in social work, because I have my degree in social work, the ethos was goodness of fit, person and environment, doing things like eco maps where we such value in engaging the extended family, not just blood relatives, but the community. And that's where mental health can really explode when people are not in isolation. But something's happened along the way. Um, Oftentimes, when we conceptually know that the village is important, its unrealized potential, we're not always taught exactly how to engage or overcome the objection of the parents of we've been there, done that, doesn't work. We burned all our bridges. We have no village. And so I think that this is one of the most unrealized potential in mental health. That if we could just tweak some things, we could increase our odds dramatically that we could turn a parent or a family from a no to a maybe to a yes. And then we have to be confident in doing this because that's another barrier we're going to talk about is like when you bring all these folks in the room, they're loaded for bear and they're ready to use that time to point fingers and yell and scream. And then we can get, there's a term called transference and countertransference. We can shut down. So it's scary. So if we can overcome this, and I can give you in 1 hour more and more confidence to, kick the tires with this, I think this can be an X factor. So with that, my hope is that when you leave today, even if it's only an hour, that you'll be energized, excited, and even inspired to share this recording with other colleagues. I've had people take this recording for a brown bag lunch and said to the whole agency, let's, I want to show this webinar that Dr. Sells did. It really will give us thought provoking, um, food for thought. So there's a lot of ways that this could be a catalyst for you individually and professionally as well. So let's talk about this here. Every month I do a free webinar. And last month, if you attended, if you didn't get this one, put your um, name in the email in the chat bar, and Allison can send this to you. It's free as well. Last month, we did love languages as a trauma repair tool. And if you attended or watched live or in the recording, there was a key moment in this webinar last month where a family was isolated for many years, and the mom said, our kids are homeschooled. All our family is in Florida. There's no village. And so I was able to expand her and the stepfather's viewpoint that the village could be the bowling instructor, the art teacher. And if you saw this, you saw that the family got totally energized by the bowling instructor coming to the meeting and saying we can do family bowling. It was a catalyst to bring the family out of isolation and the kids having joy. We called it the Village Joy Squad. And if you remember in the video, the mom was crying at the end saying, I didn't know that this could be family because I just thought of my family as, blood relatives. So I wanted to pivot off of that case study, give you another case study, and give you more of the concrete micro steps that I use that you can replicate in your practice. Um, Even if you attend as a parent, this will help because it's concrete, because you can help mobilize your own village. If you're a lay person, this will help you. If you're a clinician, it will also help. So here's the takeaways for today. Tool number one, I'm just going to highlight again more succinctly why we don't engage the extended family, um, and the cost to us and the implications of the clients that we work with if we don't do it. Then we're going to pivot to what does this mean of the what's called the battle for structure around who before what. This is a paradigm shift. I hope that many of you will have an aha moment like I never thought of it this way before. Um, and it'll be a refreshing new angle, reframe of, this whole topic of extended family or what we call village. Then I'm gonna, Allison, at the right time towards the middle of this presentation is gonna put in your chat bar, and you'll also be sent copy of these slides so you can relax while you're watching this webinar. And you'll also be getting this handout in your chat bar. And for those of you who are watching by recording, of course, it'll be included in your email. But this is a concrete tool that I want you to consider trying to move the client from a no to a maybe to a yes pretty quickly. So I want you to consider trying it out immediately. And then finally, I'm going to talk a little bit of an overview of what is a town meeting format. If you have the village in the room, you have to have it very structured, like a board meeting. If you were meeting as a CEO of your board of directors, it will help facilitate the meeting in a new way. Because one of the things that was a barrier for me is when I did, when I brought family members and extended family in the room, nobody left with clarity of roles. They would say, "We're here, but what is our role?" Um, and so this town meeting agenda will hopefully move the needle to everybody leaves your office or when you meet at the home with clarity of roles. So those are the four takeaways today that I hope I do a good job with that you'll really feel inspired. Um, okay, so just as an overview, real quick, welcome to the FST family. If this is your first time, if this is not, I just appreciate that you come every month or every other month. And My name is Dr. Scott Sells, as you already know. So we're going to be taking this technique around extended family from the book Treating the Traumatized Child. If you want to get the book off Amazon, that's up to you, but it does give the micro steps in more detail. And my goal is to teach people how to master these techniques to move from the traumatized child to work with the whole traumatized um, family. And now we're going to extend that to the village because you can take the child out of a home, but you can't take the home out of a child. So much of what we do is individual work. It's very important to do family systems work as well. Also, I want to just announce that my new book is coming out in August 14th. It's also going to be available on Audible. This is for the parents. So if you're really liking this approach, I spent 2 years on this book. It's the second edition of my first book, Parenting Your Out of Control Teenager, written way back in 2000. It sold over 100,000 copies. And so I rewrote the book. And I'm going to be taking some tools from this book because as a clinician, you can actually use this book as a primer. It's almost like a workbook where the parents, because it's written for them, can take this home and do homework in between sessions. And you can also use these tools because they are written for the parents. And in the table of contents, you see there's 8 strategies. I'm going to focus on strategy 3, which is it takes a village, mobilizing your extended family. And from that chapter in the book, I'm going to be talking about the town meeting piece. But when you have the book in your hand, you can actually go right to this chapter and ask the parents and use the tools in your session, and also ask them if they would read it in between sessions because it's written for them. Okay, so next month, save the date. We're going to be talking about tech wars. How many of you, by a show of hands, are seeing that more and more conflict with kids is around technology? That it's blowing up to sometimes 8 to 10 hours a day, and kids almost have kind of withdrawal symptoms, and it moves into aggression and power struggles when the parents try to take it away or limit it. It's also contributing to anxiety, as Jonathan Haidt in his book has talked about. So this is, if you struggle with this, or this is a key issue when you work with families, you don't want to miss this one. So please tell your friends and neighbors about this one. Again, I'll be presenting some tools from the new book on this, but Tech Wars at Home: How to Stop Aggression and Power Struggles Around Screen Time. Okay, let's get started. So, number one, why don't we engage the family? If you do me a favor, I would like to know your theory or hunch. What's a reason you think, if you could type in the chat bar, why we don't in general actively involve the village, and the village's extended family? That could include also school, CPS, probation. But why do you think that we are not engaging in the village? Let's see what people are saying here. Okay. Maria says it could be confusing and overwhelming for the patient. Way to go. I agree 100%. Anyone else? Okay. Gina says some don't want to take the time to connect. Christina, bingo. There's time constraints on us and them. Getting everyone on board with common goals, more people in the room. You've heard the term too many cooks in the kitchen. So pulling everybody along the same direction. You got more people, more opinions. Christina says dependency rather than strength based. Some don't want others in their business. Yep. ROI concerns. Exactly. So these are some real barriers that we have to overcome. And I'm going to show a few ideas around that. But thank you for your, participation. I appreciate that. I wrote down a few that I put that kind of complement some of the things you said in addition to. So I said one of my reasons, and again, this was one of my reasons early on in my career, family therapy with just the immediate family was stressful for me. I didn't get a lot of training in family therapy in school, so it was scary for me. And then when I involved the extended family, I was overwhelmed. And when I tried it a few times, it didn't go so well. People were yelling and screaming at each other. And I left saying, I don't think I have what it takes. So I would do more individual work. It was safer for me, because I didn't feel competent. I didn't feel confident. And so that was one of the barriers I had to overcome. Second one is that I didn't have step-by-step tools. What do I do with a room full of 6 or more people? Um, how do I structure the meeting? Um, what if they despise each other? What if the slightest provocation and they just explode? Um, and then what do I do to clarify everybody's roles? So these were my top two barriers that I had to overcome. And so I'm gonna kind of springboard off of those two, um, that I had to overcome. And hopefully those are some of the ones you have as well. So how do we win the battle for structure around who before what? This is an interesting concept that I want to explain a little bit here. That I didn't realize this, but as a clinician, I always started with what before who. And where this came from, where I had a light bulb moment, came from a business book by Jim Collins, Good to Great. And I read this book, and he interviewed owners of the top um, most successful businesses in each industry. He called them 10Xers, like their performance and profit margin was 10 times greater than anybody who was in their competitive field. So like Apple, Microsoft, Johnson and Johnson. And here's one of the things he found was that these leaders would say, I have to start with who before what. In fact, Jeff Bezos said, I'd rather interview 1,000 people and hire no one than make sure I hire the right person. So he framed it as we got to start who before what. Do we have the right people on the bus to get this family unstuck or individual unstuck? Do we have the wrong people off the bus or neutralized? Or do we have the right people in the right seats? And I don't know about you, but that was I could have had a V8 moment where I was like, yeah, I always start with what the goal of treatment is before I start with who. Who do we have, that needs to get this system unstuck? A classic example, I don't know if you've ever seen this, where you've got a kid and there's an old saying, triangulation equals strangulation. And so, have you ever had this happen where a kid divides and conquers, where they'll pick up the phone and call the grandparents, and they'll get the grandparents on their side, triangulate the grandparents over the parents, and you know that you can do all the treatment in the world, but if you don't stop um, you know, that triangulation, you're spinning your wheels. Or have you seen, where the other parent in the other house and the grandparents, aunts and uncles are on one side and the other parents on the other side, or the school system. This was a great one I see a lot where I've even had kids be so smart that they will make up stories to their teacher. They'll say, you should hear what my parents say about you. They think you're the worst teacher in the world. And the teacher goes, really? And then, will you tell your parents this? And so the kid is like this, like, okay, if I can get the school system and my parent system at each odds, I've divided them and I conquer them. Now, these are just some examples of why we could have what the goal of treatment is, but if we don't have the who before the what, we don't have what's called second order change. First order change may be that they're just changing because they're in treatment, but as soon as things go back to status quo, there's no long-term change. Second order change means that they are still changing and not recidivating long after you're done with the treatment. So, this is just something that in some cases it's a must have. It's not easy, but I just like this who before what. So I like all these little people, who before what. So this is called the battle for structure. What this means is that it's a tug of war. Whoever defines the treatment is successful. So how you define the treatment will determine what kind of treatment it is. So you've got this battle. You're like, I know we got to involve the extended family, but the family's pulling a tug of war saying, no, I don't define the problem as needing the extended family. So there's a battle for what the goals of treatment are and who before what. And you're like, we really need the who. before the what. And they're like, we don't agree with you. So there's this battle for structure of who's going to show up to your sessions. And if the family wins this battle, ultimately treatment can fail before it even begins. I'll give you a case study in just a moment that really shows why this child kept going in and out of residential treatment because the therapists who were treating the case did not win the battle for structure and they were not able to engage the extended family. And that was the core reason for this case as to why the case remains stuck. So think of a tug of war where you have to increase the odds, where you have more people on your side to pull the rope towards you. So let's go to that now. So, have you ever experienced the battle for structure with the who? How many of you have ever experienced this battle for structure where you're trying to define the problem as it needs the extended family, and it doesn't have to necessarily be the blood relatives, but it could be the school system, probation system, neighbors, friends. But how many of you have ever had the battle of who before what? Okay, there have been a few of you who said yes. That's very common. Amber, yes. Okay, who else? Let's see. Okay, other people as well. Erica, uh, Dacia, excellent. Okay, so, and I see some hands raised as well. So this is what happened with this case. I came in as a consultant, and we can learn from this case here. So the first step was not what you say, but how you say and do it. Let's stick a pin in that and come back to that. Not what you say, but how you say and do it. So this is the therapist, Tawanda. She said, I have a adolescent. His name is Dylan. I've just saw the intermediate family and the individual child. I know the key people are not in the room. This is the third time that Dylan has come back to treatment. I know that he is stuck in the middle. Uh, his biological parents are divorced. It was a difficult divorce. They don't like each other. My primary client is the mom. The father is remarried. The mom is remarried. The father is on the West Coast. The mother who I treat is on the East Coast, and so they said physical proximity is a barrier. So even if we wanted to bring him in, he can't come in because he's on the West Coast. We don't like each other, and then it's more complicated with the maternal grandparents or paternal grandparents. I'm sorry, taking the side of their son, and and Dylan is continuing to actively call the grandparents to get them on his side. So Tawanda said, if we don't figure this who out, we're going to have another relapse. It's not if, but when. So he's 15 years old. The reason he's come in is high aggression. Been in residential treatment. I think this is his second or third stay. The parents are obviously not on the same page. They have different parenting philosophies as well. The village is not engaged at all. And it's been a bitter custody and divorce. How many of you, by a show of hands, have had at least one client in your career that fits this profile? Um, the kid is stuck in the middle, and the village is not engaged, and you've got the complication of grandparents as well. This is very common, especially today. So I said to Tawanda, let's start with this first tool. We've got to win the battle for structure of who before what. So I said, don't ask mom if you have a village. She'll say no, or she'll say it, there is no one. But give her this handout and turn the village no into maybe a village yes. So I came in as a consultant with Tawanda. We had a Zoom call, and I said, instead of saying, "Do you have a village?" Which I always get, "I have no village." Um, I just gave this handout and had the parent start putting initials down on every single spot of who is at least in their village, not asking for what I'm going to do with this, but seeing is believing. And I also asked who is a supporter, who's not supportive. So we found out, obviously, this came out more to the front. Ex-spouse right now is not supportive. And then the grandparents were not supportive. But also, I want you to also ask for things like coaches, mentors, neighbors, probation officers, caseworkers, so you can start to see and expand the lens from immediate family to people like, and that's, I used this sheet with the family last month where the mom and stepfather had not thought of the bowling teacher as part of the village or the art teacher. They had just thought of the immediate extended family. So from that, I said, um, and that's an example of that. I said, can I give you a sample of upcoming attractions? And they said, what does that look like? And I said, if we have your ex, and first of all, we're going to do a Zoom call. So the beauty of new technology is that proximity doesn't matter because we've got Zoom, and I'm going to do what's called a town meeting. And it's going to be very clear. We're going to have who the leaders are, who's going to attend, what the ground rules are, that this is not therapy, it's a planning meeting. We're not going to talk about past fights or custody. We're going to focus on how to work together. We're going to stay on track. If things get heated, anyone can say time out. We're going to list what worked and what didn't work. So this is mediation. That's why I call it a town meeting, because we're going to leave here with specific goals so we're all on the same page. Because one of the barriers that was written in that chat bar just a second ago is everybody's on different sheets of music. So we've got to get everybody on the same sheet of music. So then what I also do is I say to folks, can I show you a sample? Um, so I have a video clip. I say these are actors, and of course your issues are going to be different, but I want to give you confidence of what the structure of the town meeting would look like. We have introductions, we talk about the problems, we brainstorm solutions, we prioritize the solutions, we clarify everybody's role in a written plan. We do dress rehearsals of what we're going to say or what we're going to do. Then we bring the child in or the teenager in, and we're going to practice our delivery. So this intrigued the mom. She's like, I'm starting to get what you mean. It's going to be very controlled encounter. Um, you're going to do an experiment, and you're showing me what's in it for me. And her husband said, I really like this. It's structured, it's clear. And I said, okay, well, let me show you a video clip of this. This is an example of, again, it may not apply to your situation, but it does a little bit because Dylan has some aggression. But let me show you just kind of like, you know how they have like movie trailers of upcoming attractions? Let me just show you what this could look like. We'll customize it, but you'll kind of see how this town agenda is really well run. Let's watch.
Hi, everyone. Hi. How's everybody doing? I have an agenda for you guys today. Here you go. Thank you. Thank you. I've asked you all here today, including my parents, James and Rosa May, because as you all know, I'm a single mom and I've been having some problems with my son, Jaden. You all are my support system, my village. And it's my hope that after today, I'll have some ideas on how to help and fix the problem that I'm having with Jaden. So let me first thank you, Mom and Dad, for coming. Thank you so much. I'd also like to thank you, Pastor Rick. Thank you. And Thelma, thank you so much. It means so much to me that you guys were able to come out today. My PLL coach Louise is here. She's going to help us. She's going to guide us as we brainstorm and find the best ideas to help.
So your role would be right here. You're the counselor. This is the mom. You've done some practice with her before the meeting even occurs, and you're empowering her, laying hands on the mom to help guide the meeting. And you're there as a coach. If in certain situations where things may be more chaotic and disorganized, maybe you in the beginning are the facilitator of the meeting. It's a case by case basis. Some families, it's going to work better when you empower the parent to lead the town meeting with a clear agenda. And sometimes, based on the family, you've got to do the work, at least initially, the heavy lifting, because the mom doesn't have the confidence, or the dad doesn't, or the grandparent doesn't. So again, have flexibility in your mind and tell your client, this is a preview of upcoming attractions.
Solve the problem that I'm having with Jaden.
Yes, I would like to thank everyone for coming today. In the old days, when parents had problems with their kids, everyone in the neighborhood knew one another and everyone supported each other. We've kind of now started to get away from that. And that's why I'm really excited and very happy that you're all here today to help in supporting mom with the problems with Jade.
First, before we start brainstorming, I'd like to tell you all about the recent problems that I've been having with Jaden. Jaden's been Jaden's been getting very aggressive with me when he doesn't get his way. He's broken two lamps and he shoved me up against a wall. This is really hard for me to talk about. It's embarrassing. I know I should have told you sooner that Jaden's gone way past disrespect and it's been getting aggressive, but I didn't.
Well, I'm just glad you're telling us now because we're going to help you fix this.
Well, there's some things I would like us to do. I would like us to start by jotting down these brainstorming ideas so that we can help give some great ideas to mom to stop Jaden's aggression.
One thing I would like to suggest is this. You have my phone number. I'm pretty much available anytime. So if you feel physically threatened or anything, all you have to do is call and I'll come right over.
And I'm willing to call you a couple times a week just to check in on you to see how things are going with your contract. I know one of the toughest things for me is to be consistent, and I want to help you in that area.
Well, let me tell you, if you think for 1 minute that Jaden is going to get aggressive with you, you just let me know and I'll set that boy straight.
Now, hang on, Rosa May. What we need to do is sit down with Jaden tonight and let him know that we all know what he's been doing and that we're going to put a stop to it.
I already feel stronger, and I'm starting to believe that I'm going to be able to stop Jaden's aggression with help. I think that just telling everyone what he is doing and what he's been doing, and him knowing that everyone knows, boy, he's going to be embarrassed. This will definitely help him think twice before he gets aggressive with me again.
So again, well, at the end we'll have plenty of time for Q&A, but what's your reaction to that? It's a little clumsy and awkward with the actors, but it can give your family confidence. Like they get to see, and I will say to families, of course, it'll be customized to you. But in the old days, that is what usually would happen, would be if a child got aggressive, the village would come in and help support. And I've had kids say to me many, many times that it's easy for me to get aggressive with mom, but when other people come in a very calculated way, I don't want to get aggressive in front of all these other people. And everybody's leaving that town meeting with clarity of roles. So after seeing this laid out, the mom definitely went from a no to a yes, let's give it a try. And Tawanda was like, I'm shocked. You don't know how many times I've tried to get to win the battle for structure. Uh, Dylan's been in treatment 3, 4 months. And then before, when he came the first time, we tried this. So these little tools you gave, Scott, the FST Village handout showing the town meeting helped give this particular mom really good psychoeducation on steroids. And a lot of times we have to do education before application. So we're just Las Vegas odds makers. We're increasing the odds of winning that battle for structure. So now here's uh, the first meeting. We have Dad on the West Coast on Zoom, Mom on the East Coast, Tawanda and me. In this first meeting, we're trying to establish the ground rules. We're trying to see if they're willing to come together and put aside their differences for the sake of Dylan. We have this town meeting that's been emailed out to everybody before the meeting. It's a very structured encounter. It's not therapy. We even say that at the beginning. So let's watch what happens when you tweak some things to make this more of an organized extended family session. Let's watch what happens next. So let's go to that. So let me set it up for you here. So we in the town meeting, we established the ground rules right out of the gate. Um, we said this is not a traditional counseling. It's an FST, Family Systems Trauma Mediation meeting. Hot topics are not going to be our focus. We're going to focus on the here and now, and our goal is to have a better working relationship between both parents. We're going to prevent bunny trails and heated arguments. That means that you're going to talk through me in the beginning. There's not going to be finger pointing, drumming up the past. Um, if that's the case, we'll call a timeout. And if the timeout works, we'll keep going. If not, we're going to end the session. Do I have a verbal yes from everybody? Yes, yes, yes. So here, I want you to watch the tactical moves that are made using the town meeting. First, we right out of the gate, we list our theory of change that it takes a village to raise a child. And we want to ask everybody if they agree, at least in theory, that Dylan is partially stuck in a rut because the village is not working together on the same sheet of music. Who before what? We normalize right out of the gate that this is not easy, but it's necessary if we're going to get Dylan unstuck. We always keep the focus on we're here for Dylan. We focus on the here and now. We talk about we cannot change the past. The question is, what are we going to do in the present and going forward? That's why we're going to avoid finger pointing in the past. We can't change it anyway, so let's focus on the future and the present. And what's in it for you all? This is for your son, so that he doesn't keep coming back to residential a third, a fourth, a fifth time. And I ask him on a scale of 1 to 5, which is a great question. How workable are you right now? What is your working relationship like? 5, you're definitely can work together as a village. 1, you're not even close. I just need to know where you're at today. So let's watch what happens here with the town meeting. And we did the prep work because the client we had to buy in, of course, is mom because she's the primary caregiver.
One of the things I said that one of my philosophies of change is to bring
both step parents and biological parents together. And sometimes, there's been scar tissue or fallout, especially when you have a child who there's been a lot of drama. Sometimes there can be finger pointing, sometimes there can be like resentment. And of course, I can't change the past. My role is like, okay, you guys are always going to be parents, even though you guys may not get along outside of that, and you might not even get along as parents right now. But if you guys do put a ceasefire and work with me, guess who benefits? Dylan, because he has a front row seat to see that something broken is restored. The question I have before I move on to Donnie and Billy is, would you guys accept that theory of change, of working together, that we're better together, or is that something that will be something that they'll take getting used to?
I think that it would be great. I mean, we're kind of already doing that now in a way, and so whereas in the past, me and our families haven't worked together, we have done a really good job the last year of working together, and doing stuff for the betterment of Dylan. So I look forward to it going forward.
It's like taking a pulse check or kicking the tires. It tells me how hard I have to work. So would you guys say on a scale of 1 to 5, 5 being you guys are really workable together as a team, you're ready, you're positioned to get ready for Dylan's return. 1, you're not even close. There's no science to this. Would you guys say you're closer to a 5 or closer to a 1? What would you say? Let's go to Becky let's go to Donnie and Billy first, because you guys haven't really had as much time to talk. So where would you say on that?
4, closer to a 5.
Wow. Okay.
In the past year, we still have our differences, but we both kind of decided to unify after, we had a very costly court battle that probably was some of Dylan's manipulation. And after that, we both recognized and decided that no matter the differences that we have, Becky and I chose to be parents, and therefore we have a responsibility. So forming a unified front is really the only answer.
So will this be the first time since Dylan has had difficulties that all of you guys will be in the same room together, having a plan of action, with me in the role of consultant and Tawanda being the primary care counselor? Will this by itself be a difference that makes a difference of having you guys all together in the same room? Is that going to be a new thing for Dylan to see, or he's seen it before?
It'll be new.
He's seen Donnie and Billy and mom and stepdad working together in the last year-ish.
They're not in the same room.
Not physically in the same room. Definitely not with Tawanda, and certainly, obviously, not with. Yeah.
So that is so significant, everyone. This case has been stuck for many, many years. 2 different therapists, 2 different treatments in residential relapse. And the family says this is the first time ever that we've been in the same room. And surprisingly, by asking that question, both Tawanda and I were both surprised that they said they were at a 4. So we were stepping on a moving train. So just to give you encouragement that winning the battle for structure, who before what, using a combination of, a preview of upcoming attractions, the town meeting agenda, coupled with the video clip, coupled with the FST handout, of a village, helped us win the battle of structure. And so here's what happens next. So, and again, I'll be saying at the end, if you really want to go deeper in this model, if you like what you see, you want to kind of connect all the dots of all the different techniques within this model. I'm showing you obviously in an hour, I can't show you everything, but I will show you what happens next. So once we win the battle for structure and we have who before what. The next step is the family's like, now what? What's the next step to go from theory to practice? So in FST, you have a very methodical, systematic way of developing what's called these written plans, which we call trauma playbooks, of allowing everybody to have clarity of roles to get one positive move as a catalyst to unstick the system. It's also attached to what's called undercurrents. So the undercurrent here was different parenting philosophies. People weren't on the same page. So you have to get the exact opposite healthy undercurrent, which means bring everybody together. So from this very successful first session, I was asking both of them that we need to bring the grandparents in because there's not maternal grandparents involved, only paternal, and they have to also be involved. So the family now had confidence in what we're doing and they involved the grandparents. So over a series of two or three more sessions, we use something called the Family Systems Trauma Apple Tree so that the family can pick out the undercurrents that are keeping them stuck. Dylan's involved as well. Then we moved to a written plan. So here's what it was. So let me show you what it looked like here. So after we did the town meeting, we went to, okay, what is our written contract, which we could call a trauma playbook, or it's just something written that clarifies everybody's role. What is everybody going to do and what's going to be the intervention? Well, the grandfather got into this because one of the interventions was special outings because Dylan had felt like such a lost child. And the men in his life, the grandfather, um, the mom's stepfather, his stepfather on his mom's side, and his biological dad have never ever worked together. And Dylan felt very lost. That's part of what's driving the aggression is the trauma, because trauma, drama equals trauma. So the grandfather, with a little bit of prodding, comes and says, let's do a camping trip. That as soon as Dylan leaves residential, um, let's all get together, the three men, and let's do a camping trip so that we can say, Dylan, you're not a lost boy. We're here for you. The past is the past. The future is the future. And then all the ladies got together with playing out the meals, and it was really a beautiful thing because it started moving them towards that healthy undercurrent of everybody being on the same page. So here's what the plan kind of looked like. This obviously the names have been changed for confidentiality, but you can see here that it was just very simple. Like, where are they going to go? Camping trip, and it was very similar to last month's thing about who, what, when, where, and how are they going to do bowling. So families really like this very clear thing that helps them move forward. So here's my call to action, and then we'll do a Q&A. Is I want you to try the village handout to not ask people, do you have a village? Just bring it out in the intake and assessment and say, could we just fill this out together? And a picture's worth 1,000 words. So you could get everybody's initials and you can talk about who's supportive or not supportive. Then you can use when the new book comes out, you can get the handout of the town meetings and inside the book. But in the meantime, you could take the slide deck and obviously photocopy or take a picture of the town meeting agenda and give it a shot. And the more organized therapy is, the better the outcome. I'll say that again. The more organized therapy is, the better the outcome. Because everybody wants to know what's in it for me. to bring the village in. And so, um, I want, if you want to do a deeper dive, once or twice a year, I do a live master class. And let me just share with you, in case you really want to go, you saw the webinar this month or maybe last month, and you're like, I really want to learn this. I want a master class with you, Dr. Sells, for 3 days, where we do Q&A and show videos, and I learn this model. I don't want to have to go back to graduate school. So these are the 12 techniques that we're going to learn over 3 days. And in order to do this, just go to familytrauma.com and click on, the uh, FST Masterclass. And you can either do an online course, but May 6th through 8th, I'm offering the live. And here's what it is. It's open to clinicians, case managers, and family support professionals. You're going to learn the techniques in detail and get scripts for each technique. It's also going to include the Treating the Traumatized Child as our reference book. And you'll also get 3-month access to my online library. And it's going to be 18 CE units, if you need CE units for your licensure. So, you're going to practice the delivery of the techniques. We're going to do breakout groups in Zoom. It's going to be a lot of fun. You'll receive the scripts for each one of these techniques. You'll learn how to adapt these for both individuals and couples. After graduation, if you want to go on for certification, that simply means that you'll onboard your training from the master class with a real family. You meet once a month with one of our consultants in in a small group of 2 to 3 people at once a month for 6 months. But you can stop at the master class or you can go on for certification. It's up to you. You're going to receive an electronic version of the book, and it's $6.95, and you can also do 2 or 3 payments if you need to. I tried to keep the course as low as I could. So here's the outcomes of this course, a masterclass. I guarantee, well, I can't guarantee anything, but I'm pretty confident from doing this many, many years that your confidence is going to skyrocket on how to do this. You're going to learn it quickly with excellence. You're going to acquire the step-by-step tools, and you don't have to do it alone. You're going to get coaching on the delivery. It's not just what you say, it's how you say it. So you'll really pinpoint the content of the script, but the delivery as well. And so if you are wanting to do this in May, which is next month, like I said, I only do one of these a year, maybe two. Go to familytrauma.com. And if you, sometimes people come with their colleagues from an agency, there's group rates available as well. So with that, let me just give you a summary of the course, and I will then take questions and answers. So, Allison, um, back to you if there were some questions about or comments about today's webinar on extended family.
Yeah, well, one of the questions that came up is what happens if the extended family is toxic?
Yeah, that is common. It's real. So, what you are looking at in the village is 1 or 2 safe people to start small. I'll say to the family, let's look at just one person maybe to pivot from there. And it doesn't always have to be blood relatives. So we look at that handout and we say, who's supportive, who's not supportive. And so maybe we kind of like take ground with a neighbor, a friend, and even for the parent to see the unfolding of how the town meeting works. And then sometimes when when the person is toxic, I divide and conquer. So this happens a lot in difficult divorce situations where the parents cannot be in the same room together. There's either abuse, domestic violence, or but there still is visitation. So once I get the mom, who's the primary custodian in this example, uh, going well with the extended family, which might be a relative or a friend to help stabilize the child at home. Then I might get assigned release to work with the other side of the system, which is the father, but the two may never meet together. But I'm trying to give similar tools. And then if things really start to work out on a case by case basis, I might have a controlled encounter. So I don't give myself a self-fulfilling prophecy that it won't work. I start where the system is or start where the client is and start to build off small success stories, but also know the reality that sometimes I have to be very creative and adaptive because the system is toxic and I just cannot have certain members together. It won't happen. So I adapt to what I've got, what I'm given. Great question. Next question.
Well, the next question is, what happens if the family says that they don't have anyone to support them?
It's a really common thing I hear, and it's a real fear that a lot of counselors, that I talk to, and again, Tawanda had the same initial reaction. Um, so a lot of times I find that a lot of families, it's not that they lack a village, but they just haven't identified or activated it. In other words, I can't tell you how many families after we've done that worksheet have said, I never thought of um, in the last month's case, a bowling instructor coming to a meeting and we do family bowling. I never thought of that the village included an art teacher or members of my church. And so a lot of times families have to have an expansion of their definition of what a village is. And also, I get a lot of the boundaries of, well, they don't live close by. So you introduce the idea of Zoom. So you map out, um, who hasn't been identified. And then you phrase it as an experiment. And you say, what do we have to lose if we try one meeting? And so that's how you kind of you know, um one small success at a time. So that's what I found is that to overcome we don't have a village, we have to use a catalytic converter like the handout to at least, see that the village is not just blood relatives. So great question. Any others?
Just, I guess the last question is, what happens if the teen just doesn't want to participate or be a part of the process?
You go with that. Um, you really are trying to support the parents at that point. So you start with the parents. You may not have the child in the session. You get the friends or neighbors to support, like you saw in the video of the town meeting example with actors. There was aggression in that case study. And so when the child starts to see a little bit of the mom or dad or grandparent calming down, things in the home are less chaotic. There's more structure, there's more predictability. A lot of times the teenager or older child will be curious because they're seeing the parent change. They're seeing the parent start to be, less stressed. And so a lot of times you go through the parents to get to the kid. And a lot of times the kids will be like, okay, I'm curious. I'm willing to come to the next meeting. Especially if grandparents are more involved in special outings, because the kid can't really see, conceptually what a village is for them. Like, what's in it for me? I just see the negative. It's new, it's foreign, it's strange. So sometimes the child, just like we all do, have to see examples visually of success before we're willing to go, I'm curious. And so don't get caught up into, well, the teenager doesn't want it, so let's just stop here. So often we take things at face value and we don't um, keep going as an experiment to unstick a stuck system. Remember, uh, I'm talking from experience. My first 10 years of my career, I was an MSW student, and the village scared me to death. And I just would look for any reason not to bring the village in. So, but when I read about who before what, that gave me more knowledge, more responsibility. The reality is that a lot of our cases have to have the who before the what. So, great question. And I guess the only other thing I would say is if those of you are kind of on the edge of the master class or not, um, I'll include the agenda in the next email with the recording so you can kind of see the breakdown of each day. And I think it will really inspire you. The type of quality of training that you'll receive, maybe unlike you've ever had before, where you'll really leave there going, I can do this. Um, I can really flex my muscles and become a master at family systems work. And it's a great complement to what I already do, whether it's EMDR or cognitive behavioral therapy. It will just really be something that you'll leave with confidence. And so that's why I do the master class, because there's something about the interaction each day where we are better together. So. All right. If there's no more questions, I hope all of you have a wonderful week. I hope this has inspired you to move the needle for the extended family. And thank you for some of the comments, like Lori saying this was enlightening. That's what I was hoping for. And Shajaya saying it's a great topic. And yeah, without you, we're not going to do this. And we need more of you to do the extended family work. So thank you. And I hope to see many of you when we do Tech Wars next month, if that's an issue that you're dealing with the families you work with. So until then, have a great week, everybody. Bye now.